in Mumbai, I know, are saying that, look, you're telling us to stay at home, not even go to offices, work from home, put all these restrictions on us. But the Kumbh Mela is going on at Haridwar. The IPL is going to begin. Do you feel that maybe we need to relook at some of these events at the moment?
We need to have a look at these events and see that we are able to, if they have to go on, we are able to have strict restrictions available so that these don't become super spreading events.
Okay. The next question, of course, sir, comes to the issue of vaccinations. The vaccination drive is picking up. Now people over 45 allowed to vaccinate. I had my vaccination over the weekend. The question is, can a vaccination bring down infections? People are worried that despite vaccinations, there are cases of reinfections coming. So how confident are you that vaccinations, a more enlarged vaccination drive will bring down infections?
So when we're looking at vaccination, we're looking at two broad things that we want to do. One is to decrease our mortality. And we know that vaccination will prevent severe disease and death as far as the high-risk group is concerned. And that is why we're focusing on vaccinating the high-risk group. The second is to prevent infection and therefore break the chain of transmission or decrease the transmission rates. That data was not that strong, but there is now recent data which is emerging even from the AstraZeneca vaccine, Covishield, which suggests that that vaccine also does help in decreasing the rate of transmission. Therefore, if we are able to vaccinate a larger and larger number of individuals, we will be able to decrease the number of cases, but that strategy alone will not work. This has to be a multi-pronged attack. Vaccination is just one part of the strategy. COVID-appropriate behavior is another part. Increasing testing in these areas and then isolating individuals, quarantining, and tracking all the contacts is another strategy. And then working on decreasing the crowds is another strategy that we need to follow. Unless we do all of this in parallel, we will not be able to really bring down the cases. So just saying that we will vaccinate and we don't need to have COVID-appropriate behavior is not correct, because this is the sense that people have, that now that vaccination is being done, they don't need to wear the mask, they can go out and party, they can go for a holiday. That attitude has created the spike that we're seeing right now.
Linked to that, doctor, a number of people are asking, what is the ideal duration between vaccinations? Some confusion over Covishield. First it was said 28 days. Now it's being suggested that it should be 6 to 10 weeks. Is there what do you recommend, and do you believe that there is a choice that Covaxin is better than Covishield? How do you look at those who would like to choose their vaccine?
So both vaccines are effective. The data is robust for both vaccines. There is really not much difference. But the Lancet study, which was done, which looked at, based on the fact that UK initially started delaying the second dose of vaccine so that they had enough doses to give right across, the data that they collected, and some of it is based on statistical analysis, did tend to show that if you were to delay the second dose beyond 6 weeks, your immunity or your antibody response was slightly better. And based on that, the duration has been from 4 to 8 weeks. And you could get it done any time between that. If you got it done after 6 weeks, probably it will give you, based on that paper, it's not a very large study, a little bit more.
So what would you recommend? What would you recommend, doctor, to someone like me who had his vaccination 2 days ago? Should I take my next dose after 6 weeks?
So if you've taken Covishield, yes, you should take it between the 6th and the 7th week.